everyone. Good evening and welcome to our masterclass tonight. We're so thrilled that you took time out of your schedule to join us. And today we have me, my name is Austin, on the call from Alterra Health. We have Dr. Adhye joining us and Whitney, and both of them will introduce themselves in just a second. We'd like to start with just a little bit of housekeeping as people log in and get started here. I would say the most important detail is we try and make these sessions as interactive as we possibly can. And so we're prepared, we're ready to go here and talk to you. But if you have questions, please write in using the Zoom chat window. We'll do our best to answer as we go along here. I know we're expecting a combination of both providers and patients. And so, same thing goes for providers. If you've seen something in clinic or, have an experience that you want to share, please also write that in. We really do want to make this as interactive as we possibly can. So please participate. In terms of timing today, we usually run these sessions between 30 and 45 minutes. So we'll be wrapped up just after 8 p.m. on the East Coast. If you're on the West Coast like we are, a little bit after 5. Again, my name is Austin from the Alterra Health team. We host these masterclasses and workshops every month. And we have a lifestyle platform that supports all aspects of lifestyle care for patients outside of clinical consults. If you're interested in learning more about that, or if you want your patients to join events like this, please be sure to let us know. You can hit reply to the confirmation email you received from Zoom, get in touch with us that way, or you can visit our website. It's alterrahealth.com, Alterra with 2 R's. That's all with housekeeping. Again, thank you guys for joining us, and I'm going to turn it over to Whitney for introductions, and let's get started.
Hello, everyone. I am Whitney Gibson. I'm a registered dietitian and co-founder of Alterra Health. I am so excited that you guys are here and we can bring this information to you and about this very topic. Really is what I'm passionate about. I love everything gut health. But a little bit about me, I'm passionate overall about holistic health and bringing lifestyle resources and tools to clinics to improve patient outcomes and their lifestyles and longevity. So tonight we're answering 5 of the commonly top asked questions related to chronic inflammation as it relates to gut health and even weight management. So we have the amazing Dr. Adhye with us, who's actually one of our partner clinics, and he's joining tonight as our expert. So Dr. Adhye, you can go ahead and give yourself a brief introduction.
Thank you. Thank you, Whitney and Austin, for the introduction. Can you guys hear me?
Oh, yeah.
Awesome. Very good. Yeah. So I'm Dr. Adhye. I'm in Napa, and I started this clinic about a year ago. And my clinic's name is Napa Valley Lifestyle and Wellness. It's been really exciting. I used to be a primary care physician before, and I still work in that aspect. But I started this clinic with the ideal that I want to not only just start a clinic, but also improve patients' lifestyle and educate them about exercise and what are the right things to do, and do like a holistic approach. And I found Austin and Whitney as really good partners. And here we are. So my clinic is in Napa, and we do holistic management for weight. And we have really been successful doing that in the first year. Actually, we just celebrated our first year anniversary and collectively lost over close to 2,000 pounds in all my patients. So it's been really exciting, and surprisingly, patients have been so receptive, which is very, very nice to hear.
Great. Thank you so much for that introduction, and we're happy to have you. So now what you're all here for, let's dive into these top 5 questions that are most asked as it relates to chronic inflammation and gut health. I'll be wrapping it up with helping with the last question related to nutrition and lifestyle. But first question, Dr. Adhye, what is inflammation and how can it cause weight gain?
Yeah, so inflammation is, this is so much ongoing nowadays, and it's such a hot topic. So really, I like that you guys have put this topic up as a masterclass. And this topic comes up, I would say, at least once a day in my clinic. And patients ask that, I'm under stress and I get, I have all this inflammation and I can't lose weight. And so when we refer to inflammation, commonly we refer to acute inflammation, which is, when you get injured, you get inflamed and it forms a scar. But what we are describing here is chronic inflammation, which we can't see. This is what happens in your gut. And the way it works is there are different mechanisms kind of doing that. There is a hormonal disruption. Then what happens in that is that there are certain hormones in our body like leptin and insulin, for example. So in a dysregulated gut, you develop insulin resistance and leptin resistance. And what it does is, for example, leptin is a hormone that is secreted by our fat cells. Ordinarily, leptin gives you the signal to the brain to stop eating if you're full. But when your gut is inflamed, that signal is gone. So you continue to feel hungry, and that I'm full message is not there anymore. So, that's kind of dysregulated that. Then I think most of us have heard about insulin resistance. And what that does is, the insulin is unable to function in the way it's supposed to function. So it's unable to absorb the glucose into the body like it's supposed to. And then you develop insulin resistance, which ultimately leads to what we commonly call as pre-diabetes or diabetes and, things like that. So all this stuff is basically a result of chronic inflammation. Then cortisol levels. So when there is chronic inflammation because of whatever reason, like stress or improper diet and lack of exercise and everything, the cortisol levels increase. And what does the cortisol do? Cortisol increases your fat storage. It causes cravings for sugar and high calorie foods. And that, I think, in clinical practice, we see that often. I have had some patients who work in the hospital, and they have moved into a night shift, and that sometimes causes disruption in their sleep schedule, and they gain weight just like that, just eating the same amount of food. And that's all the stress and lack of sleep. So that's where cortisol works in. And, then there's like poor sleep quality and stuff like that. So basically, chronic inflammation is disruption of your gut, and it influences a lot of factors, which basically make losing weight really hard, and in fact promote weight gain mainly by your gut and brain axis.
Amazing explanation. Thank you so much. You taught me a few things too. I love that explanation. Very clear. So we hear about we've heard the term second brain before as a part of the gut. Related to that, what is the enteric nervous system, and how does the gut communicate with the brain?
Yeah, this has been a really good topic of research, and I think all of us have heard the term gut feeling, right? And we have a gut feeling, and sometimes we get nervous, we get like this cramps in our stomach or whatnot, and you get these nerves in your stomach. So that's all your gut communicating to your brain. And so there is some nerve plexuses or nerves in your brain in the submucosal, which means under the layers of intestine, and in the muscle called myenteric. So there are two types of nerve plexuses in your intestine, and they communicate with the vagus nerve. And the vagus nerve is like our superhighway going from your intestine to the brain. And that can actually modulate a lot of things. It modulates your mood. It can affect your appetite and a lot of other factors. So the gut-brain axis is pretty interesting. Other than the vagus nerve, there are hormones. And one of the hormones that we actually look at is the dopamine, serotonin, and stuff like that. So, for example, there's some hormones which is called serotonin. So for people who are not medical, serotonin is basically a hormone that affects the mood, and the gut produces 95% of your serotonin. So when your gut is inflamed, the serotonin production goes down. If you're not eating the right kind of foods, or if you have a leaky gut, or if you have, say gluten intolerance or something. So what does a leaky gut do? Your serotonin production goes down. And what does that result in? You basically have anxiety, your mood disorders, and so on and so forth. And then there's the short chain fatty acids. So not to be too technical, but to keep it simple, when we eat more fiber, that generates this chemical called short chain fatty acids, and that basically will stimulate the right kind of hormones, which are GLP-1 and so on and so forth, which will basically help you feel fuller and help you kind of lose weight. So these are all the factors. There's also microbiomes, which is again something we'll touch on a little later, which eating the right kind of food develops the right kind of microbiome, which will help produce the right kind of bacteria, which will help you feel full. And the bacteria will send the right signal through the vagus nerve to the brain, which will help us feel full. If you have the wrong kind of bacteria, you don't get that signal, and guess what's going to happen? You're going to eat more food. So I really like that idea of food is medicine. So what you eat is so important, because that's better than any medicine around. And I tell this to all my patients: I'm giving you GLP-1s and so on and so forth, but if you don't eat the right kind of food, you're really wasting your time doing just medication. So please eat the right kind of food, and medications are a great support in this.
Cool.
Yeah, exactly. Support tool. Yeah.
I wanted to add something that I think is absolutely fascinating, related to the gut-brain connection, and it's your taste buds. So usually a clean gut would allow your brain to get to a point where crappy foods just don't taste good anymore. I mean, I've had several upon several patients that have tried a gut cleanse, or they've started a probiotic, or done something to somewhat clean up the health of their gut. And quite simply, foods do not taste the same anymore. So that is proof in itself too, that, your gut is a second brain, and it communicates with your taste buds. So, I just think it's fascinating. And this is why I love this topic so much, the fascination of how everything is connected, and it really ties into the food choices that you make. Speaking of food, what foods or habits can cause inflammation and disrupt gut health?
Well, that list is long.
Yes.
So we cannot go on and on for a long time. But I think if you sum it up, into like what kind of food will cause the maximum inflammation is processed food, and that's kind of the food that I think we should stay away from. And that's actually like my kind of advice to all my patients coming in. I said, anything you eat, just see how processed it is. It could be little processed to highly processed. So I think it's super important to have the processed food. And how does that? And what happens in processed food? So processed food is basically very attractive. You go to a supermarket, it's all sales, coupons, everything right in front of you, whereas all the healthy food is tucked away in the corner. So I think the processed food has all these preservatives in them. They have added sugars. They have all kinds of additives that we don't know how they act, and they suppress them. They change the microbiome. They cause leaky gut. They change the way your body signals to be full, and you tend to overeat. So I think processed food would be like the number one thing, and that includes like refined sugar, high fructose corn syrup, and artificial sweeteners, and so on and so forth. I think that would be like the foods to avoid. So anything that is minimally processed or unprocessed is probably the best. I think even canned food is processed, but is minimally processed. But I really advise my patients to stick to as little processed as you can. The highly processed food, which was very, very common, we see them is pizzas and the fries and burgers and so on and so forth. They're highly processed, and frozen meals and so on and so forth, which are also very common nowadays because of our busy lifestyle.
Right, exactly.
Guys, when you have a stopping point, sorry, we got some questions, so I don't know, Whitney, like when a good point to answer those is. I just want to make sure we don't miss them.
Let's do it now. Let's see. To deal with inflammation, blah, 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 blah. What would provide the best gut health? We're going to cover that one, Dr. Katz, in just a second. Monica, isn't it true though that the serotonin, which is created by the gut, does not enter the brain? Monica, so Dr. Adhye, Monica says, isn't it true though that the serotonin, which is created by the gut, does not enter the brain?
It does affect it though. It does, yeah, the serotonin does not cross the blood-brain barrier, but it does affect it by means of the vagus nerve as to how it regulates your mood and so on and so forth. So there is no, it's only 10% of your serotonin is produced in the brain. It's mostly in the gut, but it does affect it the way you feel and everything by the amount of food you eat. But that's a good one.
And Artie, we're going to get to that question as well. So we'll come, the one about prebiotic, probiotic, gut health foods, we'll cover that in just 2 seconds. Or the last question, we'll cover that.
Yeah.
Okay, next question. Oh, actually, the second half of that question we somewhat already covered. So what foods or habits can cause inflammation and disrupt gut health? So we talked about high stress, poor sleep, and then we'll kind of cover that in our last question as well with lifestyle. Next question.
One more thing I just wanted to touch on is meats. You know, so in our conversation with patients, a lot of things come on diet and proteins. Like, you know, everybody is like, you go to Costco, there's proteins everywhere, like high protein drink, this and that. And like, you know, so people ask me all the time about what kind of protein is good. Is animal protein or plant-based protein and everything. And there's nothing against animal protein, but processed meats are something that I really advise my patients not to have, because red meat and especially processed red meat can cause inflammation in the gut and does cause you to not be able to lose weight.
Yeah, definitely adding a variety of proteins is my biggest recommendation is, you know, when you're opting for proteins, you want to have a little bit of everything, both in the animal-based world, animal byproducts, but also put a focus on your plant-based proteins as well, because that's where we are introducing prebiotics, probiotics, digestive, good for our digestive health.
Yeah, the other thing also in the meats, because this happens now that we have spring and summer coming up, is barbecuing, you know. So when you barbecue a lot and, you know, it does cause your meat to release some chemicals. They're called HCAs, basically heterocyclic amines. And they basically are, I mean, this is not proven, but hypothetically are precancerous. So the best way to cook food is cooking and boiling or steaming compared to like barbecuing. Not to say that don't barbecue, but, you know, people eating smoked meats on a regular basis, you know, is probably not a great idea because of the chemicals released in them.
Agreed. Okay, last question for you solely. Or how does an unhealthy gut affect mood, cravings, and energy levels?
So we discussed a little bit about that with the serotonin and everything. So if the gut is inflamed or like it's doesn't have the right kind of microbiome, it gives the wrong signals to the hormones, and the hormones that are regulating the gut are the GLP-1s, the PYY. So these hormones, they have a straight connection to the hypothalamus, and hypothalamus has two sets of neurons. There's neurons that stimulate appetite, and there's neurons that do not stimulate appetite. They stimulate hunger. They stimulate they basically suppress appetite. So depending on how your microbiome is, the neurons that are stimulated may be the wrong kind of neurons and make you feel hungry. So I think, so how do we improve our microbiome? So I think the best way to improve the microbiome is basically eating as unprocessed food as possible, natural fruits and vegetables, plenty of sleep, even exercise. Exercise is supposed to improve your motility, gut motility, and improve the microbiome that you have. So so that is kind of like, it's not that like earth-shattering, but it's amazing how much changing your diet will help you with your mood, your leaky gut, and so on and so forth.
I kind of make the point to all of my patients is you're only as healthy as your gut is.
Yeah.
Just because the gut really does control so many things in your life, and what that looks like in the terms of which our next question, I'll go ahead and introduce that. And I'm going to be using my notes. So I'm reading a bit up here, guys. What simple steps can improve gut health, reduce inflammation, and support weight loss? So to kind of frame this in the form of foods. So number one is fiber. So fiber is one thing that's going to feed good gut bacteria. So we want to load up on veggies, fruits, legumes, whole grains like oats and quinoa. These do feed good gut bacteria. You can kind of think of your gut, the inside of your gut, as it is a microbiome, but something that you want to feed good things, and you don't want to feed it bad things. It's literally eating the things that you're introducing to it to flourish. One other area of foods or food products that you can introduce are fermented foods. Yogurt has live cultures in it. Kefir, I don't know if I'm pronouncing that wrong. I've heard it kefir and kefir, so sorry guys if I'm butchering that. They call it the champagne of dairy, but I use that with yogurt and chia seeds to make like a little chia pudding with fruit in the morning. So that's one way to use that if you're kind of shy about using it. But sauerkraut, kimchi, kombucha. I love kombucha. So there's so many products in the market right now that are really big on gut health. It just really takes some time, slow down in the grocery store and see what's available. But anything that has live cultures or that has probiotics in it or prebiotics, those are really great choices. For the inflammatory factor, we want to, science shows us that we can include omega-3 rich foods and supplements. I'm a dietitian that will tell you food first. That's going to be the biggest or the most bioavailable form of omega-3s, best absorbed, but there is a time and place for supplements as well. But foods that have the highest amount of omega-3s would be fatty fish like salmon. There's a little bit in tuna, walnuts, chia seeds, olive oils. So we really want those healthy fats in our diet as well, just to really combat inflammation or chronic inflammation, and the gut loves it. I wanted to kind of expand on the processed foods just to give some applicable examples for our patients or even doctors to kind of inform your patients. So when we say the word refined carbs, that word is used a lot, and I'm not sure that the overall audience really even knows what the word refined means. So to define refined, it's basically processed carbohydrates. They've been stripped of their fiber, their vitamins and minerals, and their nutrients during the manufacturing process. So they digest quickly. So if there's no fiber left, that means that digestion is very fast. The faster the digestion, the faster it spikes your blood sugar. So your gut does not like these. When you introduce these types of products to your gut, it just sends it into an inflammatory stage. So when we have inflammation, it's very hard to lose weight. So therefore, you may experience weight gain or resistance to losing weight, and just overall digestion and gut issues. So to give actual examples of refined carbs, white bread, white pasta, pasta made from white flour, so white, pastry, cookies, cakes, most breakfast cereals. So I don't care if it's organic or not, most breakfast cereals, sugary snacks, crackers, pretzels. So you could simply flip over the label and see, does this have any amount of fiber in it whatsoever? And if there's zero fiber in your packaged products like this, put it back. Just to give a few healthier swaps, whole grains, fiber rich foods, sprouted or sourdough bread. Sourdough bread has the lowest amount of gluten naturally. I'm talking about homemade sourdough, not necessarily the sourdough that's on your counter that has a lot more ingredients. The other lifestyle factors: manage your stress and move daily, prioritize sleep. I think we've kind of made that point, and stay hydrated just to aid in digestion, because when we are increasing fiber, we want to increase fluid. That's what makes it work. Overall, small, consistent changes make an enormous difference, guys. What does RT say? I think I answered y'all's questions, maybe. Let's see, what would be the first indication of bad gut health or early signs of gut inflammation? I'll add my take and you can add your take. Go ahead.
Yeah, so I think that's a good question. So I think what's the first sign? Really, like, if people start noticing that they're getting bloating and, GI issues, mainly like frequent stomach upsets, then, frequent bloating, or like, occasional diarrhea, or even weight gain, and a lot of people come to me saying that, oh, I haven't like really changed anything and I just keep gaining weight. And, it's what you eat, it's the portions and all that, but also what you eat makes you gain the weight. And it basically changes the way your gut is signaling to your brain. And that causes all this kind of inflammation. So those are the first kind of signs. So people with no digestive issues doesn't mean they have perfect gut, but those are the kind of signs that people associate with. And to Dr. Katz's question, I think, about the prebiotics, what would we recommend? So I think most of the people kind of know what is prebiotic and postbiotic, or probiotics. So probiotics are basically live organisms that, you get lactobacillus and everything in the market. Prebiotics are natural things like onions, garlics, and, like Whitney said, fermented foods, which is yogurt and stuff like that, are things that increase the live organisms. So prebiotics are something that promote the organisms in your gut. So like spices, turmeric, and herbs and all that, they are like kind of prebiotics. So what would you recommend? I would say mixture of both, but I generally don't tell patients to take probiotics. I just tell them to have a more natural food that has probiotic, like yogurt and whatever, however you pronounce it, like kefir or kefir or whatever like that. Yeah. So I think that probably is the best, but some people are more inclined to take lactobacillus, and I said, you're more than welcome to go to Whole Foods or CVS and get some probiotics if you feel like necessary. But I think natural is always probably the best.
This brings up, there's a book that I picked up years ago, and it's called The Bloated Belly, I think. And there's a bloated belly quiz that you can take online if you feel like you have leaky gut or something's going on with your digestive system. It's literally a self-assessment that you can take, and it would actually help you guide the conversation for your doctor. So you're kind of doing the background research on yourself and you're presenting what it is. So that can kind of help narrow down what it might be. It's not always going to be leaky gut. But what I'm trying to add here too is probiotics, like in supplement form, are not necessarily the answer. If there's truly something underlying going on in your gut and you've got some type of infection, or you've got an overgrowth of yeast or some type of bacteria that's already existing, sometimes if you add a probiotic on top of that, you're only proliferating the bad bacteria that's already in there. So if you truly think that there's something going on with your gut, do some background research, do some assessments on yourself, have some really deep conversations, but being highly aware of what's going on, that can be very helpful to begin with. But like Dr. Adhye was saying, it's better to go with food first, add some fiber in, do your basic fermented foods, see where that gets you. But I wanted to also piggyback on that question about what are the signs? I'm going to talk about poop for a second because I'm a dietitian and that's what I do. So another sign of leaky gut or your gut health not being in check could be, days of constipation, or I shouldn't say constipation. It is days to diagnose constipation, but constipation in general, or stools that are not formed. If you're just going to the bathroom and it's just a ploppy mess, that's a sign that you're not getting good fiber in your diet, and you probably need some fiber and fluids. But you should have, do your poop research, guys. I'm not going to get into it here too much, but that is a sign. I mean, your poop tells you how healthy you are and how in check your gut is. So that's something to really discuss with your provider or even your dietitian, because we do all talk about poop.
Yeah, I think one of the things is also, like, sometimes you have overgrowth of the bacteria in your gut, and there's a medical condition called small intestinal bacterial overgrowth.
Yes.
And that causes a lot of it's called SIBO, but that causes a lot of bloating and indigestion and a lot of pain and like this kind of like very soft mushy stools that are been constantly like plaguing people. And I've actually, in this last few months, actually diagnosed 2 of my patients with SIBO. The testing is a little hard, but it's actually treatable with antibiotics and everything like that.
Was that the one with the breath test?
Yeah, it's a breath test.
Okay. Did we
But
have
there
any-
is all these things that you need not to do the breath test. So it's a little complicated to do. But once you do it, I think it's very, very useful to diagnose it.
Oh, for sure. The gut's a complicated thing. Thank you, Dr. Katz. Kefir. That's what he
There
said.
you go.
I got a lesson today. I don't know that we answered this. Are there any sex-based and age-related differences regarding chronic inflammation?
I don't know really. That's a good question, actually, Yvette. So I'm not sure whether I've studied that as a sex-based or age-related. So something I would love to look into that, but I'm not really 100% sure about studies that confirm that they're sex-based related to chronic inflammation.
Yeah.
I don't know if Dr. Katz knows it or anybody else knows it, but at least I'm not aware of reading studies to that effect.
I could go into thinking mode right now, but I'll spare everybody. All right. Anybody else have any questions? I think we covered everything. We did. Any other questions? I wanted to go over artificial sweeteners just for 2 seconds. So we tend to think that, oh, that was another thing. Reduce alcohol. Alcohol feeds bad bacteria.
Yeah.
And
Alcohol does feed
inflammation.
bacteria. Yeah. It was in my thought to say it, but I did not. So
It was in one of my lower notes here. But yes, reduce alcohol consumption. That is an inflammatory itself, terrible for the brain, and it feeds bad bacteria. But also artificial sweeteners. So we tend to think just because it's non-nutritive or that it does not add calories or spike your blood sugar or minimally spike your blood sugar, that they're safe. But literally your body does not know what to do with them. So I could kind of say that with any of the foods that we've mentioned, the refined carbohydrates or any of those, not so optimal foods, your gut just really, it doesn't belong there in the first place. So you're actually making your body work in overdrive, trying to process these things that doesn't belong there in the first place. But why do we eat all these things? Why do we not sleep so well? Why do we not exercise? At the end of the day, we're telling ourselves we don't have time to prioritize our health, our nutrition, our exercise, but that is absolutely farthest from the truth. We don't live to work. So, in our classes, in our program itself, we are very, very focused on lifestyle and teaching you how to prioritize yourself. And I know Dr. Adhye is extremely good about doing that in his office as well. We can see that in your patients that work with us. So, prioritize lifestyle, guys, for optimal gut health.
that's true.
Yep.
Also, like the other question that my patients frequently ask me is that, oh, I love soda, so I switched to diet soda. And that's another thing that, oh, there's 0 calories, but it has all sorts of artificial things that cause gut inflammation, and you may be getting 0 calories, but you actually are going to gain weight with that.
Yeah. At the end of the day, it's not about the calories, it's the quality of the calorie that's going in.
Yep. Monk fruit extract. I haven't heard anybody take that actually. Have you heard anything? Maybe Whitney has an idea. Monk fruit extract.
Yeah, I used to do a blend of monk fruit extract, but I'm also kind of conscious of the environment too sometimes. And when there's an item on the shelf that's really, really a fad item, that just kind of tells me it's probably not so healthy for the environment. It may be healthier for us, but monk fruit extract, yes. I know you can find some blends as well, because monk fruit extract tends to be a little bit on the okay, so stevia products tend to be more on the bitter side. So sometimes they'll add something sweeter like monk fruit extract to kind of balance that out. So you'll find it by itself or a mixture of sorts, but that would be more of a natural choice rather than like your artificial sweeteners like, Splenda or
aspartame and like that.
Did we miss any questions? Last chance, guys. We'll close it out. 5, 4, 3, 2, 1. Anything else you want to add, Dr. Adhye?
No, thank you for giving this opportunity. And this is really exciting. I hope to continue to do more of these master classes. It's fun.
For sure. It is fun. And, we'll continue to bring you guys topics that are that are, top of mind and interesting, and really the topics that are going to make the largest impact in your health and wellness journeys. Women's health is definitely on our minds lately, with menopause, perimenopause. So you'll be seeing that coming up in the next few months. We have one coming up on Austin. When's our Chat GPT one? Do you know the date right off the top of your head?
I think it's the 22nd.
That's what okay. So the 22nd, guys, watch out for an invite for a session with one of our collaborative dietitians, Jane Guo. She's going to be teaching the audience, both providers and patients, how to effectively chat with Chat GPT in making nutrition strategies or forming nutrition strategies. So if you're a patient who's wanting to talk to Chat GPT, make me a meal plan. It's not as simple as that. You do have to give it somewhat a direction. So she actually does trainings on this. So that'll be a very interesting workshop. So catch that one with us, but I'll go ahead and hand it over to Austin.
Awesome. Well, thanks for everyone for taking time out of your day to join us here, Dr. Adhye. We really appreciate it. And again, if you have any questions for us, providers, if you have questions about how to get your patients involved in what we do, you can visit our website. It's alterrahealth.com, Alterra with 2 R's, or just click reply to the confirmation email you received from Zoom, and that'll go straight to Whitney. So thanks, guys. I think we're good to go here, and give us 30 minutes or so, and we'll send this recording to your inboxes as well. So please share it, friends, family, other providers. If providers on the call, if you want to share it with your patients, please forward it. And we'd love to see you for our next event on the 22nd.
Thanks.
Awesome. Thanks, guys. Have a good evening.